So another quick video that we had to make
as a matter of necessity.
And this video actually is almost going to be like a complete guide to what you are supposed to know about snake bites, right? There's a lot of information out there, tidbits, lots of information, many of them false. But once you finish watching this video, be sure that you're going to have all the accurate information. I want to start by saying that it's a bad thing when anybody dies. So we commiserate to the family of Funaya who lost her life to a snake bite. But we must also realize that in Nigeria, many people die from snake bites. Yes, many people die from snake bites. But the thing is that most of those that are bitten by snakes are farmers.
Yeah.
Cattle herders, all those guys that drive cattle, hunters,
people who walk in the bush, rural dwellers.
So you will not hear of it. So how many times where you live, how many times have you heard that anybody had a snake bite? They are rare in these developed places or the urban places, but many of them,
they do happen.
Yes. By the way,
and in the northern part of Nigeria, it's commoner in the northern part of Nigeria than other places in Nigeria.
Yes. By the way, and very, very importantly, I served in Kaltungo, Gombe State. Kaltungo, Gombe State, snake bites, they are like pure water. They are like pure. So there's a center for research for snake bites in Gombe State, and in fact it was in the hospital where I worked. Of course I never worked in that particular center, but that center was in the hospital where I served. So I have some good information about
where they
snake bite.
They didn't pay his salary. I can't forget it. That if you are watching this video, better pay him his salary.
That's Nigeria for you. All right, so now one thing we must also say as we start this video is that there's lots of misinformation, not only about snake bites, but about many things in particular in Nigeria. And a lot of health education is necessary. So I'll give you examples. I want to talk about
that video of TV.
Let's wait, before I even go there, we are going to go into the snake bite. But before I go into that, Nigerians have this. There's something like someone collapses.
Yeah.
What are they going to start doing? They will pour water.
Yes.
Where did you get that from? Oh, so that means have you not noticed when time you bring patients to the hospital, do we pour water on their heads? Let me give you another one. So a child is convulsing. What do? They put spoon in the mouth. They say don't let him close his teeth. Once he closes his teeth, he will die. Where did you? What kind of misinformation?
I guess they are passed down stuff. I don't know.
And no matter how much you try, people
are just hell-bent on their old ways, and that would explain why someone on a TV, a reputable TV station, young people will be saying things
that are very.
At least ChatGPT or Meta AI is there. If you are going to discuss something, go and look at it. Go and look at it first before you start coming to spit. I don't want to complete that statement.
Okay, so now that we have given that background, you need to know that the study of medicine is not fairy tales. It's not old wives'
It's not your opinion. It's not about your opinion. It's about what research has done. It's science evidence.
Yes, it's evidence.
So you can't just come up and be talking what you think is right.
In Nigeria now, everybody knows.
To put up that particular. Everybody has an opinion these days, and think we need to stop that. It's getting very annoying.
Be very be sure of what you are saying now.
Exactly.
Okay, so now
it was just a display. I put up that video up, and someone said, "Who are these charlatans?" Yeah. And that was just the exact word to describe what those people were displaying on TV. Charlatans.
Reputable TV.
In fact,
now, I'm not going to even mention a TV any name, so you cannot do it. But you see, this is it, a TV station. I noticed that they put up that panel. I don't know. I don't even know
who are the people. What's their qualification?
Those guys don't know anything about what they were discussing. But I also noticed that in one of their videos, they actually interviewed a doctor.
Okay.
Now, it's also important when you are interviewing any doctor, interview the specialists in that field. This is a TV station.
There are cadres, you know, doctors have cadres. Different levels of specialty and different levels of experience. Because I think the problem here was the specialty.
Yeah. Now you don't just say it's not politics. Now we are not okay. So they interviewed this doctor, and it was obvious that that was not his area of strength. So before you go and say, oh, I want to put, that is TV, or everybody around the world is watching. You don't just go up and just say, oh, let's interview him because it's a political thing. No. But they now did another interview. I think that was yesterday, where they called somebody who was a specialist in managing snakebite, and the difference was clear. The difference was clear.
But unfortunately, that other video was already out. I think they should find a way to recall. We are not mentioning names,
yes,
because it doesn't.
No, they should take down that video.
They should take that video. It doesn't speak well of them at all.
Now we now go into the examination of the whole scenario, and then tell you how to go about managing snake bites. Snake bites, like we've said, are common. There are many species of snakes.
Yeah, there are different types.
Every doctor is taught about snake bites in medical school.
Yeah.
And there's a lot of information regarding snakes. There are species of snakes. You go and meet the zoologists. There are different breeds of snakes, and there are different ways that they attack the body. But to keep it very simple, just know that they are venomous snakes and they are the non-venomous
ones. For the in fact, many of them are non-venomous.
Most of them are non-venomous.
They are non-venomous and they would actually not kill.
Yes, so the fact that a snake is also venomous doesn't mean that when a snake bites, that the person is going to be envenomated.
Usually, there's one way to know. Of course, you don't want a bite. They have teeth, so to say, and they have fangs. The ones that have fangs have venom.
Yes.
And the way the puncture wound of the teeth is different from when you see the fang.
Yeah.
So, and that's one quick way to know. And then, apart from the fact that you say for people who can identify snakes, there are groups that are common in different places. In Nigeria, they have the vipers. They are the commonest ones that cause release venom that can cause mortality and morbidity. So,
what we are saying in essence is that doctors study these things. We study the way patients present after the snake bites. So if the patient is bitten by a snake and you have 2 clear points, those are the fangs of that particular snake, and it means that the person might have been envenomated. People also have a problem with medical personnel asking many questions. They say, why are they asking that one? Why are they asking that one? But you don't know that those questions are important. You want to know the size of the snake. You want to see if you can find the type of snake, because that's very, very important
in managing that person.
Managing them.
In fact, you want to know the circumstance and the scenario.
Yes.
Because when they are provoked,
yes,
usually they say snakes are they don't bite when they are not provoked. But you know, in a circumstance, let's say a snake crawls into a person's bed now. The person doesn't know whether the person is just turning and moving.
Yes,
it just feels that this person wants to attack me, and then or you are trying to chase a snake. You know, there are different scenarios that can be with different degrees of envenomation.
There's lots of information. In fact, you want to know whether the person was wearing a dress when the snake beats the person. So please don't be angry when they are asking those questions. So that's number one. I think the next thing we need to now go into is this particular scenario.
Okay, it's also good that if you can describe the snake.
Yes, if you can describe the snake.
Don't try. They say don't try chasing the snake to kill the snake, because you are wasting time in the process. You know, the thing can cause multiple attacks in the process. But if you can take a picture, it will also help. If it's possible to take the picture, it will also. And there's this belief that if you kill the snake, the oro in codes in Yoruba.
That's nonsense.
So no,
nonsense.
so you don't go chasing to kill, but try and identify. Is it black? Is it, you know, you can give an inclination into what type of snake it is.
Yeah, this education is very important, because usually when people are bitten by snakes, what is the first thing? The first thing is that they are very afraid.
Calm down.
Yeah. So, but you need to understand that you need to calm down at that point. You need to call for help. And when these people come in to help you, they are not the ones that are supposed to make you more agitated.
Okay.
So let's look at what happened to this upcoming singer. She was beaten. We don't know at what time, but what we know is that she went to some hospitals.
I think by herself. I read that.
Yes, she was. She
took herself.
Yes, she was she had a no. She went in all these taxis, maybe Uber and all those things. So went to one hospital after the other. Now, this is the point I'm going to make here. What is happening in Nigeria now is that many hospitals are trying to avoid any trouble,
controversy.
So once they come to you and they look at you and they say this one, and it's because of the way you are dragging them online, because those hospitals.
If you know that song, that's a Yoruba song. What I'm saying is that all this dragging is going to cause problems. People are trying to say, me, I don't want wahala.
Once you come, we don't have, don't worry, we don't just have.
Because I don't want wahala.
That's number one. Number two is, sometimes Nigerians are going to the hospital and they are asking for a particular treatment. So you are going to the hospital and you are saying, do you have anti-snake venom? Do you have? They say we don't have, and you leave the place because they say they don't have. Meanwhile, you are forgetting that in managing snake bites, it's not all about
the anti-snake venom. It's not just about the anti-snake venom.
There are many other things
that needs to be done. And in the process of transporting herself from one place to the other, you know, moving all over the place, because immobilizing the
so at this point,
that
we
was
need to talk
beaten
about,
is what is paramount, which every person should know as a first aid measure. It's not about sucking out the section. You want to suck out the venom, or you want to put incisions.
You don't cut on the wound.
What you need to do for that person, it's not about tying tourniquet.
It's not tying tourniquet. You see, those are the things that we do commonly, but they are wrong.
No, because you can cause gangrene. Because the venom itself, depending on the type of snake, can cause tissue damage. You only faster cause damage of that tissue because blood is not flowing by tying tourniquet. So what you need to do is to immobilize that place. You can get cardboard or pali, what we call cartons, fold them, use them, and tie a cloth around. Maybe we can have a pictorial representation of that
so you know, I know, but the thing is that yes, we are supposed to immobilize. But what I've discovered is that many times we need to be a bit practical. You know, I told you that I served in Kaltungo. It's not in those places. You don't tell anybody to tie anything. What you just do is that don't use that limb. If it's a limb, for example, if it's this hand now, just hold the hand. And don't use it to carry things. Just hold it in a position and transport the person to the hospital.
I was even going to say, because I didn't finish what I was trying to say. I was saying they talk about compression immobilization, but studies have even found that if done by someone who is not competent, even that compression immobilization I'm talking about, many people don't have the skills to do it. Even healthcare professionals. So it can even cause more harm than good. So just as you were going to say, just not moving that limb, ensuring that limb is not being moved, is very important. Because
I've also seen videos of people saying you put something, you put bandage. Can I show how many houses have bandage in their houses? How many people have bandage in their houses? You don't have a
We are talking about the practicality of something happening now. What do we do?
What you do is go away from the snake, call for help, make sure that you are not, for example, if it's the lower limb, you are not running up and down. You running up and down, you are making it worse.
Exactly.
So, and what you were saying the other time, if there's a snake bite on the hand and you tie, what a tourniquet do? You see, people don't understand the way the body works. Let me give you an example. Somebody eats poison, right? He eats poison. Do you know how many seconds it takes for the poison to get into the system, for the body to absorb it? He now eats the poison. You now say he should drink palm oil, as if no, that's what is going to take away the poison. So what's happening is, as that venom has gone into it has gone into the system. So that's why when she was saying don't cut, you cutting and doing all and squeezing does not change the venom that has gone into the system. When you tie something tight here and you say you don't want the venom to pass, you are deceiving yourself. It's already in the system. It has passed.
Passing. It's a question of how the rates.
Yes.
So get that, it's the rate that we want to limit.
And
we want to limit the rate, because the envenomation can be localized or systemic, like affect that part of the body or go into the whole body. So I was going to also say, let's just say it happens that there are people around that have a marker. I know people don't go around having markers or let's say a biro or something. What you can also do is to help mark that area where there's a snake bite. I know this is done at the hospital, but let's say peradventure you just have something around like a pen or a marker or something. Just mark that area. It helps the healthcare professional by the time you get to the hospital.
Okay, so we have told you what to do if there is a snake bite. It's not about when you tie the tourniquet. What will happen is that the effects of the toxin will be very, very prominent in that area. What now happens is that it destroys the tissue in that area. Then when you finally remove the tourniquet, what happens? The person just dies, because all the toxins that have accumulated, not even really from the snake bite itself, but from tissue damage.
From tissue damage.
You know, so usually what we now, there are many things. So medicine this takes a lot of training. So if for people who have tied the tourniquet, there's a way that we actually remove the tourniquet even when they come to the hospital.
Yeah.
We have to apply another tourniquet that we can control.
Yeah.
We apply that tourniquet above it, remove this tourniquet so that we can slowly release it.
Yeah.
So that we don't release the whole thing into the system.
So let me explain something. When there's an irritant or something, a poison or an inflammatory response, what we call inflammation, starts. And what is inflammation? The body's response to something it doesn't like. So chemicals are released. Those chemicals that are released are the ones causing harm. Do you understand? Did you get that?
Okay, so we have cleared the tying of tourniquet.
No.
Don't tie tourniquet. So you can already see that we have already broken even the main thing that they have been shouting around online about. You tie the tourniquet, it is even wrong. You shouldn't have done that.
No.
Okay, so the other thing you need to know the effects of I'm going to only talk about two of them, and which are the most common. There are effects on the central nervous system. The central nervous system affects our thoughts, the brains, and the nerves. So generally speaking, if that particular toxin affects the nervous system, the person begins is paralysis, and you may begin to see the person having their speech is slurred. Now I'm saying these things just because of the number of things I've seen online. Like people were saying the lady was still talking very well. You are not in a position to say the lady was talking very well, because there are ways we test whether the thing has affected the nervous system. It's not just about her talking.
Yeah.
All right, so let's be careful of some of these narratives. The other thing is that it affects body blood cells.
The blood prevents blood from clotting.
So the person will just continue bleeding
into different parts.
This video is not so much of we are trying to make it very clear. We are not trying to give you complex terminology or anything. Now, what's the next thing that I want us to talk about? This anti-snake venom. The anti-snake venom, you know, like we've said, there are many species of snakes.
You can imagine.
Many species. But now, in this environment, a lot of research has actually been done, as like in Nigeria.
Yeah.
it's not magic. So it's not like once the person gets that what's going to happen is the person is just going to be fine.
Like a miracle. You give it bam and the person becomes no.
So many people die despite even getting the message.
So people can react to the antivenom itself, and that's why even though you want to quickly, if you think that this the snake bite is by a poisonous wound, one of the first things you want to do is to quickly administer antivenom. But if a snake bite is not a venomous one, you don't want to give an antivenom, because you want to weigh the risk versus benefit. Because the teaching is that if there's that and you are giving the antivenom, there are also things that you must put on the standby as supportive treatment in case the person you give the antivenom to reacts to it.
So can I shock you? Can I shock you?
So people can even die from
that lady might
antivenom.
have died from the antivenom.
We are not saying that was
We are not saying that's what happened, but it could happen.
It could happen.
So everybody shouting, they didn't have antivenom there. So they've given the antivenom and the person died.
The
person
teaching
could react.
The teaching is
as
that,
a matter of fact, let me even tell you, but we don't have the full story, but the way it was described, that immediately they hung up drip, the lady died. That death was a bit fast. It looked like maybe she might have actually had an anaphylactic reaction to the antivenom.
So that reaction to that I was talking about to the antivenom is an anaphylactic reaction. The body is saying, oh, I don't like this, and then release it, the body just shuts down. Even to that antivenom that you people are shouting about.
So which is why every time the patient comes with a snake bite, it's not for you to just quickly say, where is that antivenom?
You want to determine what is the risk versus benefit of giving this thing, and then you must have things on the standby, resuscitative measures, ability to take over the airway if need be. If there's a reaction to that antivenom, all the supportive management must be there. Fluid, they were saying, why would they
why would they give drip? Why will you give drip?
Hey,
that is the height of
ignorance.
Because even the antivenom is given in a drip.
Jesus. It's not malaria.
It's like they don't know when you don't know what a drip is, you don't know what a fluid is. So do you think that as the person has been bitten by a snake, there's no blood flowing in the person's system anymore?
Because one of the things that the snake poison does, one of the things it can do is actually to cause what we call shock.
Yeah.
Reduce circulation. And you must be able to support that by giving fluids.
So
the treatment itself of the antivenom can also cause anaphylaxis, and you must still be able to support with fluids to help the circulation.
Yeah. So you can see that there are a lot of puncture holes in the narratives that you are seeing everywhere around the country. You should not give drip. You should not do this. No, don't say what you don't know. Very, very important.
So let's try and wrap this up, because this video is getting long and we know that our attention span sometimes. All right, so let's try and, in a nutshell, what are we saying? Snake bite, of course, is common, especially in rural areas. There are occupations, farmers, hunters who are more predisposed to snake bite. But peradventure there's a snake bite, what should you do? Do not panic. Call for help. Try and identify the snake. Move yourself away from where the snake is. Please, immobilization, which means as simple as not moving that limb, is very important. Do not move the limb. Immobilize the limb. So if it's on the hand, it's on the leg, ensure that you do not use that particular area. If you have a pen or a marker around, you can do well to circle that area of bite and go to the hospital as soon as possible. A good hospital at that. At the hospital, they will ask you questions. It's not just because they are trying to waste your time. Those questions are important for them to give you the appropriate treatment. It might not even be a venomous snake in the first place. That may just require watchful waiting and supportive treatment. In some cases, when it is already determined that the snake bite is poisonous and there's evidence of envenomation, whether local or systemic, treatment is activated. IV fluid is important, other supportive measures are important, and the giving of polyvalent anti-snake venom as soon as possible. But remember the caveat. Even in giving the anti-snake venom, you must also have things to support that person in case the person goes into anaphylactic shock and things like that. Things to take over the respiration, things to support the circulation. So I hope this video has helped you.
Just in closing, what I want to say is that because we've not talked about the healthcare provider themselves, so what I would just say is do we realize that a number of these healthcare providers are on strike? So you might not hear the full story, but you'll be asking yourself, okay, why didn't they just move to ICU? Are you aware that there's a strike?
Who will man the ICU?
And nobody's saying anything about it. There's been a strike for
how long?
For several months.
Nobody's
saying anything about it. Right.
And now, all of a sudden, someone dies. You are still blaming the healthcare system. All right. The people we need to attack. Please, let's channel our attack to the right place.
Yeah, please, if you have questions, if you have things that we've said that you
do not understand,
please put them in the comment section.
We'll be willing to answer you. Thank you.
Put your questions. Let's make it interactive. All right.